Good afternoon, dear patients. Today we will discuss a case of a condition known as paronychia, or a painful inflammation of the nail folds of the big toe. An elderly man recently came to us who suffered from a chronic case of excessive sweating of the feet. Along with this condition, he unfortunately developed a severe inflammation around the area. The nail of his big toe. When pressing on the edge of the nail, it was visible that a small, barely noticeable drop of pus was released. In addition, it was slightly painful, although not as painful as it usually is with true purulent lesions. He also had symptoms of maceration on his foot. On looking closely at the protective layer of the proximal nail fold that naturally overlaps the base of the nail plate, there was absolutely no visible separation or structural crack to be found anywhere along the surface area. This specific condition involves the painful swelling and redness of the inflamed nail fold, which is the area of skin that surrounds and protects the edges of your fingernail or your toenail from infection. Inflammation around the nail fold. Can be caused by various bacteria, which happens somewhat more often on the feet. The second cause is the occurrence due to fungi, particularly of the genus Calvina. The latter are more often localized on the hands. This disease is called Becker's disease. Whenever an individual finds themselves frequently coming into direct contact with environments characterized by high humidity, and they are simultaneously exposed to a significantly large amount of glucose, and then on top of all those factors, intense heat and excessive sweating are also present in the situation. All of this contributes to the introduction of Candida into the nail fold. If you look closely at the picture, you can also see a wing-like lesion of the nail. It appears whiter. This is not natural nail layering of the nail. So what was done? A culture was taken from this barely noticeable pus on the surface of the eruptions. PCR tests for 8 types of Candida were also taken from the same spot. These are the main tests. The edge of this nail was taken as well. It was examined under a microscope for fungus. These are the tests that were conducted, as a result of which PCR analysis detected Candida albicans, and pseudomycelium was found during microscopic examination of the nails for fungus. Accordingly, this is a candidal lesion of the nail folds and even the nails themselves. It has already begun, which is caused by excessive sweating and improperly chosen footwear, and it requires treatment. Accordingly, we administered injections, literally 3 injections of diflucan daily, together with calcium gluconate as an anti-edema medication. Basically, this almost completely caused the peeling to come off from the nail fold. On the 4th day, the administration of medication via injection is the more preferable approach in this case, primarily because of the patient's advanced age, the presence of abnormal vascular growth, and other related clinical factors. Injections reach the site of inflammation more easily and simply. Topically, antifungal ointments were prescribed. Accordingly, it is always necessary to rule out purulent inflammation here, and in such cases, abscesses need to be opened and the pus removed. But in the case of fungal infections, to begin the treatment process effectively, you first need to treat the Candida infection itself. And secondly, as a vital preventive measure, it is absolutely essential to ensure that the patient at least applies antifungal creams or topical solutions after washing, at least once daily. Furthermore, diligently preventing the accumulation of excessive moisture helps ensure that such candidiasis will be significantly less likely to develop or recur on dry skin surfaces. That's why it's necessary not only to treat such diseases, but also to prevent their recurrence, since Candida can quite easily colonize both the skin and the nails, and cause similar outbreaks to reappear. See you next time.